Thanks for staying with us on our Healthy Tuesday segment. We'll be discussing glaucoma, the causes, symptoms, and diagnosis. Joining us now on the show is a senior consultant, ophthalmologist, and glaucoma specialist, Dr. Adonla Ogunru. Welcome to the show, madam.
Thank you.
So many people just hear of glaucoma, but they have no idea what it really is. They just know, oh, I'm going for surgery of eyes or something wrong with my eyes. What exactly is glaucoma and how is it detected?
Thank you very much for having me. Glaucoma is a disease of the optic nerve, and the optic nerve is the nerve that gives vision. And this disease is actually eye pressure related. And most of the time, it occurs with increasing age, and it does not give symptoms. In most cases, the patient does not even know that he or she has glaucoma because it doesn't give pain, no red eyes, nothing. But in some cases, some may actually feel like, oh, I see rainbows around bulbs, and that may be what will actually, prompt them to come into the hospital. But in most cases, it doesn't give.
Wow.
So how do you now know that something is wrong for a young person if it doesn't give signs, no symptoms, and to also prevent it?
There are risk factors that are associated with glaucoma. Somebody who has a family history of glaucoma, we have to present for, screening, and it's only by screening the individual that the person will be found whether he has glaucoma or early stage of glaucoma. By the time an individual comes complaining of poor vision and it's due to glaucoma, perhaps 60% of the nerves would have been affected.
Whoa.
And the nerve damage is irreversible, unfortunately.
Kidding me?
Yes.
Wow.
Okay. Welcome, doctor.
Thank
Good to
you.
have you. So I'd like you to clarify, does glaucoma have anything to do with sugar, excess sugar? Is it sugar related?
It's not sugar related at all. It's mainly the eye pressure. And the eye pressure is built up. We all produce what we call the aqueous and by the ciliary body in the eye. And the drainage is within the eye itself through the trabecular meshwork. When the fluid drains out, then it's able, physiologically, you're able to control the pressure below 21. But there are cases that the drainage becomes narrowed down and is not able to drain this aqueous fluid. And then the fluid builds up within the eye and then builds up the pressure, usually above 21.
Most Nigerians are used to going to see an optician, but you're an ophthalmologist. They don't even understand at what point do I move from an optician to an ophthalmologist, or even the difference, many don't even know.
Thank you very much. Well, an ophthalmologist is a trained medical doctor and specializes in the eye. As you have gynecologists that are basically medical doctors specializing in the obstetrics or gynecology, so you have ophthalmologists being specialized in eyes. And the optometrist, it's mainly optical, which has to do with glasses.
Okay.
And they are not medical doctors. Okay?
So they just have a basic knowledge. So I have this heat in the eye. I could be reading and suddenly I'll have this pain as if there's heat affecting my eyes. I have to close my eyes, force out tears for it to get relief. I have to stop reading. So it has really slowed me down. When I went to as you mentioned, the doctor, most likely an optician, and I had a test done. They had this whole set of, but I just felt I wasn't seeing someone who understood what I was saying. The first time I went, they ran through some tests and said, okay, it was something due, it's called dry eyes. I said, okay, what exactly would I have to do? They didn't have an idea. So I left that clinic and went to another clinic where I was tested. I had good vision. I could see well. I could do everything. I read everything that was shown to me until it was the tiniest. And then they gave me glasses that's supposed to help me read. It helps.
So let me
It's not exactly a relief. Right now, I'm even having
So let me put a question to what she just said. So as a regular Nigerian, if I have a problem with my eyes, the first place I go to is an optician. Because I believe I might need glasses.
Yes.
So how do I know to go to an
No, I even want her
ophthalmologist?
to explain what this is, because I've seen a lot of people who know what this, who have the same condition, and we all just see doctors who don't know what it is.
Well, usually after 40, if an individual sees far properly, like 6'6", by the time the person gets 40 and above, we find it difficult to read the small print.
Smallest print.
We call that presbyopia. It's a natural incidence, and that is normally corrected with glasses.
Okay.
With increasing age, the power will increase, but that's just normal.
Right.
It doesn't have to do with glaucoma. But the thing is, because glaucoma increases with age, you know, the risk of having glaucoma increases. So glaucoma, the person will also be screened for glaucoma while you are presenting yourself for, you know, presbyopia or dry eyes. Dry eyes is common now because we read most of the time on the system and all that.
That was much.
Okay, but so let me now put my own question, because the question I wanted you to answer is that most Nigerians will not ordinarily come to you. So it's like all your customers are probably going to opticians, and they'll probably do that for a few years before someone else says, maybe we should try an
ophthalmologist.
So how do I, as a person, what should I have? What kind of symptoms must I see before I call for an ophthalmologist or go to the doctor to see someone like you?
Well, the thing is, as a Nigerian, it's just that we may not know the difference. But when you have an issue with your body,
yes,
you go to a medical doctor, right? It's just the same thing. If you have issues with the eye is also part of the body. You can go to the ophthalmologist, and then the ophthalmologist will do everything with the refractions, which has to do with the eye test and the optical test, with the whole examination of the eyes. And they will be able to make a diagnosis. It's important to make diagnosis of any eye treatment or any eye disease that an individual presents with. And then you now give treatment.
What does it mean to build eye pressure? What does that mean? Because I've heard that in recent times that your eye pressure is very high and then they have to recommend glasses. What does that mean?
The eye pressure has to do with the aqueous, which is produced within the eye. And the normal pressure is between 10 to 21. But when the pressure is being built up, then that is what leads to glaucoma, because it continues to damage the optic nerve that comes from the brain into the eye to give vision. And it takes a long time before the effect of the nerve damage is seen, even in normal activities or daily activities of an individual.
Does this affect children?
It does. And for people that are that have the family history, they are at risk. You have what we call the juvenile glaucoma. That those people will present at teenagers, and we've had those that have had maybe even one eye lost to glaucoma before their presentation.
Wow.
Jesus Christ.
And there are children that may be born with glaucoma. They come with maybe large eyeballs, which we call the bullseye, but they come, those ones will come with watering eyes, pain, they're not comfortable, they're not able to open their eyes and all that.
Right here.
All this glaucoma thing is getting me a little nervous. So I want to move a little away from it, if it's fine with you, Ma.
Okay.
So recently, I had a reason to take a child to a pediatrician, a female pediatrician, and as she attended to the child, wanted the atmosphere to be less tense. So I asked her how she got into the profession and if she thought it was lucrative or if she was going to encourage her children to go into it. And she gave me a very negative response, you know. And looking at your profile, I saw you also did an MBA. So tell us, for the young doctors who are aspiring to be ophthalmologists, what do you think about this profession, this line of medicine?
Hey God, yeah?
Well, as an ophthalmologist, it's quite interesting because the thing is, everybody we all have eyes. and without the eyes, you can move. And when you see somebody who is blind, you feel concerned, and you want to help that individual to see, and you want to either rehabilitate that person if the person cannot even see with treatment and all that. But that's one of the things that brought me into ophthalmology.
Passion.
And that passion for it, and seeing people like cataracts, when you do cataract surgery and the patient sees, you see that joy coming into their lives, and you see the whole life.
Somebody
change.
had a question of floaters in the eye. Can that lead to glaucomas? I don't know what floaters mean.
Well, floaters, this happen when there is degeneration, changes within the vitreous, that's the gel at the back of the eye, and it could be like cobwebs or just like dots. The most important thing, many people may have floaters, which is
Harmful.
which is not bad, or which is not going to lead to anything. But the thing is, it's commoner in people that are short-sighted. And also, when an individual has floaters, it's important to dilate the eyes and also examine the person's retina. Be sure that the person doesn't have a retinal degeneration or a retinal hole or tear that may lead to detachment or other disease.
That was check it.
Check.
Okay, so I wanted you to talk about the advocacy for glaucoma. What are you doing so people can know when to check it? Because you said it's silent, it doesn't come with pain. It just presents itself finally. How would you advocate that at this age, age, or how frequent? Dentists will say every 6 months, see a dentist. How frequent would you say see an ophthalmologist?
Well, for somebody who has a family history of glaucoma, every 6 months, the person should check the eyes, check the pressure, look at the back of the eye. Then sometimes we have to do what we call the visual field, if there's any change. If the person, and there are some tests that will need to be done, like every year, for those that have history. Those that do not have, at least every year, everybody should be checking. Because, yes.
Every year, you should just be checking. So I felt very bad that I never checked my son, because I just assumed that he has my genes. The two girls already, their own signs started showing. So we saw it, and then we had to take them to the hospital. But for him, he had never said anything. He had never complained. Only for a few weeks, he started saying he was seeing blood. The letters were dancing. And I'm like, please, let's check this out. And we were told that he desperately needed to have the eyeglasses. So, but I'm more into prevention. Is there anything you can do to preserve your eye health? Is there any lifestyle that you would advise people to, to preserve? I don't want to believe that once you have something in your eye, there's no hope.
Well, it's important. One thing is regular exercises, balanced diet, and always checking the eyes. I mean, sunglasses, if you work in the sun most of the time, that's very important.
That's one thing I've always never...
Let's talk about...
Then the screen time exposure
should
reduce. And if you have to stay so long, you may
Let's talk about somebody who's been
lubricants.
diagnosed with glaucoma. What kind of treatments are available? What options does the person have? You said something about being irreversible. How do you treat it? Can it be treated?
Yes, it can be treated.
Okay.
And it's a lifetime management. And the treatments could start with use of eye drops. There are different types of eye drops that are used. And also laser treatment is available, and surgical treatment. It's an individual-based, choice of treatment, depending on the level or the stage of diagnosis this person is presenting. For somebody who has advanced loss of the nerves, you may want to do surgery, because that will you want to make sure that the pressure is very low, lower than 12.
When people hear surgery in Nigeria, they want to fly abroad. Yes, how equipped do you think we are here to address glaucoma issues or need for surgery in our country?
Well, we are, if we go to the right place, the ophthalmologists are trained doctors and surgeons, eye surgeons, that will be able to do the commonest one we do is trabeculectomy, and it is able to reduce the pressure and is able to keep the vision for a long time.
Fantastic.
Sorry, one last question, ma. One of my friends just had this injection in the eye. What was that for? What? Yeah.
Well, there are different types of injections
Okay.
you give in the eye.
Okay.
And is the person diabetic or
No.
something?
No.
Or has a degeneration in the macula? You know, there are many injections. The person had surgery before.
No.
Okay, so a lot of questions.
You have
so
to ask your
tell your friends to go and do consultation. But let's talk about.
What would you
go ahead.
advise to prevent, you mentioned wearing sunglasses. Okay, because YK drives with sunglasses. She said it was recommended. I say, hey. So some of these things that we can do to prevent, to protect and preserve our eyes. What are the things you suggest?
What else?
Of course, if your glasses is recommended for you,
Please wait.
wait.
You
Nima.
don't wear glasses, and I mean, you seem to be at least above 40. Minimum.
Yeah.
Like,
Your eyes are good.
Is it hereditary, or is it something that, based on your own care for your eye, that you're not wearing glasses today?
Well, if I have to wear, I talked about the distant vision being good. And if you have to read small prints, you may need the glasses. That's just reading glasses. And you may not need it.
So
What does yeast do for someone that,
Yeast.
they've been yeasting us since we were little. So what does yeast do in the eyes? What does it do?
Well, yeast is just like a supplement like vitamin A. But
it helps the eye now.
Oh, really?
Or no?
You
We should
That
go
used
in
to, used to do
Not be
baking.
the one for
Yes.
baking.
No, there's a
tablet or something.
There's a supplement we're giving as kids, because my elder sister, while we were in primary 2, her GS3, she just couldn't see. She wore thick glasses, thick bottom.
those bottle ones.
yeah.
So, and suddenly she sees well.
With the
and
yeast.
there was a treatment she took for that period of time that my dad was taking her to Ikoyi for, and after a while she just stops. She just could see. So everybody there has yeast. Take care on.
What about 7 C's and cod liver?
All those things.
Vitamin
what
A.
exactly?
Okay.
They're all vitamin
Vitamin A.
A. Yeah.
And palm oil. We should eat
Palm
more
oil.
palm oil.
With the
Vitamin
top
A.
of my tire.
Oh, I'm glad. So, I mean, as we wrap up, I mean, we have just
There's a
few seconds.
question for you online. Medina is asking, does dry eyes lead to glaucoma?
No.
Yeah, very do. Okay.
Just need to use lubricants.
What kind of lubricant?
So
One
go to
for
the doctor.
eye, yo.
Let them go to the doctor and go and find it, please.
Before you go and try the other one.
Lubricant.
That is all. We have to thank you, Dr. Ogunro, for joining us this
Thank you
morning,
very
for
much.
educating Nigerians on this glaucoma, because it was really interesting. As I said, many Nigerians don't know about it, and they are not aware. And if they go to see an ophthalmologist at least once a year, to know. So if you think, once you're wearing glasses, you think you're okay, I don't have any eye problem. But beyond that, that's just for you to see, it's just the optics, right? But really to check the care of your eye, the same way you check for your heart, you check for your kidneys, your liver, your uterus and all that stuff.
your
You need a
eyes.
doctor who cares for the eye. So I will also pay attention, because I don't do that. I'll go and check my eye.
Me too.
Thank you so much.
As well.
for joining. That is all we can take on today's show. Have a great day, and we'll see you tomorrow. Bye for now.
Bye.